Thanks, Farad. Well, rather than going back over and telling you what you just heard right now, I'm going to do that after lunch because I think the decay will probably be more significant then. So we want to jump into questions, but I just would like to reflect on, from an equity perspective, what are the barriers and policies that created the deficiencies that are having to be made up by programs like this in the first place, and whether there are employers that are addressing those barriers and policies in the first place. We have one example in the obesity prevention world called mission readiness that are retired generals and concerned about the lack of preparation of the incoming recruits into the military because they tend to be out of physical condition, largely obese, and they go out of their field, which is the defense, and speak to policy, speak to the power base and say things need to change because our national security depends on a different type of capable recruit, and so they can speak to policy. They can speak to the conditions that exist to try to change things in favor of their business, which is national defense. The same might be said of other business in our community too, to go beyond the walls and consider great programs like these, but what is being done from a policy perspective to make these programs obsolete because we have the right kinds of education, the right kinds of social supports, and the right kinds of systems that give us the employees that we need that are capable and ready to take a job right away. That said, I want to go back to what they said, and please, any questions that you might have ready to ask right now, line up, and then we can move into lunch when we're ready. So questions for our presenters?
Sandy Magnan from the Institute of Clinical Systems Improvement. So, Ali, I am a native North Carolinian, and you made me proud here, made in Durham. I'm about 30 miles, and Oxford is my hometown. Yeah. So, is this spreading within North Carolina? Is it spreading in other places? This kind of made in Durham, it has just an inherent appeal about we're going to tackle this. I loved your loop. You started with what does business need, and then you back it up and you say to the students, this is what we're hearing. Now, how are we going to get you prepared for that? Is it spreading to other cities in North Carolina or other places? Or?
Yeah, I think it will after you have, is this working? No, you probably hear me though, right? I think it will after we prove the model. The whole idea is some things happen because of reaction. So some of the reaction here were that we built this long-term stay hotel downtown called a prison, and it was filled with a lot of people who were kids of color. We have poverty rates and pockets that are really bad in an environment that shows we have the rich and the poor. And we knew that for us to continue to go to the next level, that we had to create some social entrepreneurship opportunities, working with groups like yours, and make sure we created the right ecosystem for people to succeed. Because, our state we have 100 counties, as you know, and 15 of those counties are urban, and we talk about those: Charlotte, Asheville, Durham, Raleigh. But then 85 are very rural. And in those rural counties, they don't have internet, they don't necessarily have good health care. There's a lot of determinants that are affecting those communities. So what we want to do is create a positive model of how do you make this work so that we can start spreading it around our state in the different counties.
Thank you.
Ray.
Ray Baxter from the Roundtable. Thank you both very much for your presentations and for the terrific work that you're doing. I'd like to push on the health angle of this. And my question is, we often find it easy to make a connection between economic development, opportunity, having meaningful work and so forth, and health at the conceptual level and at the population level, at the societal level. Do you see anything at the individual level of the people that you are working with and trying to gain access to the workforce? And are they either presenting with particular health problems that we need to be sensitive to and address? And as they move into the work world successfully, do we see that having any impact on health, or is that something that's sort of next generation for us to look at?
It's a wonderful question. It's something we've tried to think about. I mean, in terms of presenting problems, there are certainly a lot of people presenting with histories of addiction, mental health problems, post-traumatic stress, sometimes for the youth from what they've seen in their neighborhood. You know, sometimes it's veterans or, you know, variety in there. And some, to some extent, developmental disabilities also. So I would say those are some of the issues that are coming in, and obviously many of those are there's a lack of support to address those issues, or they're stigmatized health issues. I think that's a huge, huge factor. They're not things that people want to admit to or take care of. And sometimes by kind of coming in the door of work, let's go to work, let's get a job, sometimes that makes people more willing to sort of deal with some underlying conditions that may be actually preventing them from continuing to work. The evidence and the information about the actual impact of work on health, bless you, is really mixed from what I've been able to see, and there's not a lot. So I mean, I would challenge those in the health field in the room. We don't have very good information, very good data on the impact of work directly on health, and it would be good, I think it would be useful to study that. Obviously, access to health services often increases for people once they're employed, although now with the ACA that's changing a little bit. But there's kind of mixed data on that, so we don't have a good answer on that yet.
And so working with the business community, what I found out is that healthcare cost has affected business decisions, and unfortunately. So in my role as an economic development person, what happened with the new legislation on Affordable Care Act, right? ACA, right? Is that now you're getting more people to be able to get into the health system. So last year, before it all passed, I remember there were some employers that said, I don't want to participate because my costs with Blue Cross Blue Shield or United Health had gone up so much that they moved a lot of their employees to 1099s or consultants, or decided they want to have employees work only 30 hours so they wouldn't have to cover the cost. So business found a way to make sure that the economics would not adversely affect their bottom line, especially when they were in tough times. So I think there's an opportunity to look at how do when you onboard people into your business to measure their health. But the way business sees it is what happens to the premiums because of their pool of employees. It's particularly smaller and medium-sized businesses. I did see, I work with the YMCA in Durham, and we had a partnership with, I think, the Robert Wood Foundation, as well as with the guy that last spoke from Partnership for a Healthy America, working with the YMCA, that we're now incorporating health in the way that we live. So we're talking with kids and adults, and Duke created a community medicine Just for Us program where they actually had docs going out to homes of older people, particularly people of color in their community, to start doing kind of telemedicine and on-site medicine to try to improve the health of communities. Because in communities of color, some of the elders are really important to how things impact the community. So if they're sick, that may send a bad message. And to make sure we have a good town-gown relationship with Duke, they found a way to incorporate themselves to deal with some of the health issues that may be adversely affecting communities of color, so that it could be more of a partnership so we can build that.
Thank you.
So I have some knowledge of the health field, being a physician, and there are correlations between individual health and employment that appear in the literature, even with regard to this population in particular. As you gain jobs, especially jobs that have health coverage, you get attention to illnesses that would have been neglected otherwise, and health conditions can be addressed and are shown in data, and we have seen studies where there is even greater attention to preventive care. Also, violence decreases, incidence of violence, incidence of substance abuse by people who are unemployed is much higher among the unemployed than among the employed. Stressors, emotional wellness and emotional health improves significantly, much lower, higher rates of depression among the unemployed than among the employed. And so forth. We have better statistics with regard to chronic disease. Among the unemployed, chronic disease, especially multiple dose diagnosed chronic disease, combination substance use, chronic disease, mental illness with chronic disease, and multiple chronic diseases is much higher among the unemployed than among the employed. So yeah, there's really a good correlation that employment can be, is very good for your health. George.
It's Dave, actually. Dave Kindig, University of Wisconsin, and co-chair of the roundtable. Carla, I think I missed your funding model, so I don't know what I was doing. So I'd like to hear a little bit more about that. But the reason is, I was thinking as both of you were talking, whether I was intrigued by Ian Galloway's comment about how the regulatory provisions in the Community Investment Act, are geared more towards physical capital than for sort of human capital investments, and how he could imagine in the future maybe some things that could change it would be helpful. And was that making me wonder if there was a way that kind of what you do, maybe through some of those either current or future changes, could actually build into a pay-for-success model in this human capital side in the kind of work that you're doing, rather than just relying on annual grants or however you're funded.
I didn't hear the first thing you said, what you had missed.
I kind of missed your funding model, sort of what.
Oh, the funding model.
Right.
Okay.
Right.
Yeah. So yes, in terms of the funding model for REDF, we're a not-for-profit. We're a combination of funding from the federal government, from individual donors, from foundations. We're not we're not a social enterprise ourselves. We're an intermediary, and we move capital, from one place to the other. In terms of your question, I'm so glad you asked the question about the Community Reinvestment Act and pay for success in this context. So we think there are substantial opportunities in both for capital to be invested in these kinds of social enterprises. With the CRA specifically, we've started to talk to our friends in the banking community, because we believe, I believe we had this conversation with Ian also, we believe that CRA investments in social enterprises that employ people who face significant barriers to work should definitely qualify for CRA credit. But in order to allow the banks to see that, we need some banks to take the risk to do it and run it through the regulatory process and get the regulators to bless it. So it's happened once or twice, but not, it needs to happen a few times, and we need to be able to get the word out about it. But we don't see, and we've talked to several banks about it, we don't see any, hurdles to that. It should be able to happen, but we need some banks that are interested, and there are several banks that are interested in investing in social enterprise. On the pay-for-success side, there's definitely opportunity, particularly for those enterprises that are serving people for whom you can measure the cost and impact to government in a relatively short time frame, and in a way that is compelling enough to government that they're willing to make that repayment once you've demonstrated success. We have one entity in our portfolio, a wonderful organization called the Center for Employment Opportunities, started in New York, now they're in California, Oklahoma, a number of other places. In New York State, they are at the center of one of the only, kind of live pay-for-success deals in the country to demonstrate employment of people exiting prison, They have a random control trial that has showed reductions to prison, jail, new crime. So the state has made a deal with them. They've gotten an investment. Once they hit those marks, the state is going to repay the investors. And we're working on a similar project with them here in California and San Diego to see if we can get that off the ground. So it's a great opportunity, definitely.
Hi, thank you for those terrific presentations. My name is Vera Ozuransky, and I'm with the Vitality Institute. So, Farad, the hotels that you mentioned, we actually know that those are the #1 providers of mental health services in this country. And so I'm wondering, how are you working with these youth on connecting them to mental health services? Are you working with stakeholders in the community? And then also, are you leveraging technologies at all? Because certainly with this age group, that could be a really great way to enhance access.
Yeah, I think that's a good point. So there's two things you got to talk about, right? There's the stigma of mental health for this community, so we got to deal with that. But one of the ways that we've gotten around it, excuse me, is to provide coaching and mentors for these young adults, right? So from a standpoint of that they're learning skills, and I am a big proponent recognizing that some people that we see now may not have come from the background that we perceive, that they have tougher backgrounds, and they not having the social skills, they won't stay employed. So by giving them a mentor who's a CEO, a minority that's a CEO of a marketing company, or pulling someone out of Duke that's a doctor supporting them, giving them some of that training, that social, I call it social capital training, helps them to probably deal with some of those issues to get to the next step. So there is no formality in mental health to address mental health, but there is structure in making sure that we provide coaching for them to improve their social skills to get to this point.
Yeah, I mean, one observation, I kind of mentioned it earlier too, to complement that. I mean, it's with stigmatizing health issues like mental health problems. It is really interesting that I think there is a way that employment can provide you a door in that can then allow people to deal with some of the issues that they may have in the context of trying to keep or get a job. And I think a lot more could be done so that you don't have to walk through a door marked, I have a mental health problem, I have an addiction problem, in order to get service. You're walking through a door that says, I want a job, and I need help getting a job, and then, oh, maybe I'm having some issues that I need to deal with in order to get and keep a job. Then I need access to the health services that will help me to do that. So I think there's something important there.
Thank you. I'd like to thank Carla and Farad right now, but we're going to see them back, so hold your applause. And we're going to return after lunch.
Okay, thank you all very much for hanging in for a stimulating morning. It's time for lunch. Take a walk also during that time. And we will return here at 1:15. I would urge you to don't lose this presentation as the calories enter your body. Keep this in mind. Please write down or jot down if there are things that were struck you that you'd like to hear more about or that you want to pursue further. We'll be back here at 1:15. George will kick us off, provide maybe a little framing, and then we'll have another half hour of discussion of this before we move on. So again, join me in thanking all of our panelists this morning, and see you after lunch.